Welcome to our monthly webinar, Making a Difference, Social Isolation, Vision, Hearing, and Falls Prevention. Our presenters are Kirsten Dorsey and Valerie Biediger. Valerie is the Health and Wellness Specialist with the Alamo Council on Governments, Bear Agency on Aging. She assists people over the age of 60 with maintaining independence, mobility, and quality of life through evidence-based programs focusing on falls prevention, increased exercise, nutrition, and healthy eating. Valerie is a master trainer for A Matter of Balance, and she's also trained in Texercise and Texercise Select and Bingo Size. Kirsten Dorsey is the National Program Director for A Matter of Balance, Managing Concerns About Falls, Lay Leader Model. She's an occupational therapist who spent time working with adults after falls and is now very excited to be focusing on preventing falls. We look forward to you enjoying our presentation.
Our learning objectives and goals for today are to learn about the Matter of Balance, Managing Concerns About Falls Lay Leader program. We'll also experience vision and hearing loss through a simulator in order to understand how changes in sight and/or hearing impairment impact participation in group programming. We'll identify strategies by the Bear Area Agency on Aging supporting individuals with vision and/or hearing loss in a Matter of Balance, Managing Concerns About Falls programs. And we'll also formulate a plan to increase participation of older adults with vision and/or hearing loss into your evidence-based falls prevention programs.
Let's start by talking about what we know about falls. So more than 1/3 of adults age 65 and older fall each year. People with vision loss are 2 times as likely to experience multiple falls as those with normal vision. People with mild hearing loss are nearly 3 times as likely to fall, with each 10 decibels of hearing loss increasing falls risk. And we found that information from the CDC and the NCOA website for Johns Hopkins Medicine. So we also know that 1/2 to 2/3 of falls occur around the home. Most falls occur within routine activities, and falls aren't usually just caused by one thing. It's a combination of things coming together. Call that multifactorial. And that is actually good news, because if we can impact those fall risk factors and reduce them, then a large portion of falls can be preventable. This slide shows how high your risk of falling is in proportion to the number of risk factors you have. So if you have 0 risk factors for falls, you're still about 8% likely to have a fall within a year. If you have 1 risk factor, then you have about 19% chance of falling. But if you have 4 or more risk factors, that percentage of you having a fall goes way up to 78%. So as you can see, even by reducing 1 or 2 risk factors, your chances of having a fall can go way down. So we do know that falls are fairly common, they are predictable, and they can be preventable. We also know that falls are not a natural part of aging. Well, we also know that fear of falling is a risk factor for falls. It is reasonable to be concerned about falling. And about 1/3 to 1/2 of older adults acknowledge having that fear of falling. And fear of falling has been associated with decreased life satisfaction, increased frailty, depression, decreased mobility, and participation with social activities. And being sedentary can really lead to decreased muscle and bone strength, so that if a person does have a fall, it's much more likely that they won't be able to get up after a fall and that they'll be injured from having a fall. The fear of falling is also a contributor to social isolation. When people become afraid to go to the places that bring them together with the people that are important to them, they can become isolated, lonely, cut off, and again, much more sedentary. Now I'd like to talk a little bit about what the Matter Balance Managing Concerns About Falls Lay Leader program is. The Matter Balance program is an evidence-based falls prevention program, and it's really designed to help increase activity levels for older adults by helping to reduce that fear of falling. A Matter of Balance is designed for older adults who are concerned about falls, have possibly sustained a fall in the past. They've begun to restrict their activity because of concerns about falling. But those folks are also interested in improving flexibility, balance, and strength. And our average age of participation in our program is about 72. However, it's really designed for folks who are of any age, but primarily over the age of 60, who are still community dwelling and able to problem solve. The Matter Balance program is conducted over 8 two-hour sessions. And in those sessions, participants learn to view falls and fear of falling as controllable. And they really set realistic goals for increasing their activity levels. Our participants work to change their environment to reduce their fall risk factors. And we promote exercise to increase strength and balance. So here's a little bit about what happens during those classes. We really focus on a lot of group discussion. We problem solve together. We work on building skills to prevent falls. We talk about what assertiveness has to do with falls prevention. We watch some videos as part of the program. We also do exercises as part of our program as well to start developing that habit of exercising and increasing our activity. And then we work together to share practical solutions for falls prevention. We really value the opinions and knowledge of all the people that attend our classes, because it's all that collected knowledge in the room that really helps to make the Matter Balance program so special and meaningful. Here are our program outcomes. When people fill out their last class survey, we collect the data, and we've been looking at that for over 20 years. And 99% of the people who participate in our program plan to continue exercising. 98% would recommend the Matter Balance program to a family member or a friend. 97% of those folks feel more comfortable with increasing their activity levels. And 97% of participants are more comfortable talking about their fear of falling. We really value that, because when you start to talk about your fear of falling with the people who are close to you, then you can help to get their solutions as well to help prevent those falls. And then you can see some of the quotes that we have from people who have participated in our program. One woman said, "I'm picking up my feet more when I walk. I'm not trying to carry all my groceries at once into my home. And I'm using a cane more when I walk on my lawn. And I'm turning on more lights as I travel in my home." That's quite a lot of changes somebody had instituted just from taking the program. And the next person said, "I feel better about being careful. My confidence has risen, and I'm being more assertive and feel good about it, not intimidated."
We're going to take some time now to show you a vision and hearing loss simulator that was created by the Minnesota Department of Health Services. And the simulator is great. It allows for 4 different settings that or situations that can be that people find themselves in. There's people playing cards. There's a family situation, I believe in the kitchen. And then there's a personal care assistant talking to one of her care recipients. And then we have a yoga class. And so we're going to use the yoga class scenario as our example today. And we'll be going through 3 different types of vision loss and a couple of hearing loss levels. We'll do mild and moderate for the different vision loss scenarios that we'll see. So we're going to take a few moments just to listen to a yoga class when you have good vision and hearing.
On the left hip, and the head goes. So all your weight is holding onto the side of the chair. You're using gravity. Nice deep breath. And come back up. Back to the center. Switch which foot is forward. Everyone hear me okay? Mm-hmm. Okay.
That would be your regular vision and hearing during a yoga class. So now let's look at vision loss. We'll look specifically at cataracts to begin with. In a normal vision, this is what you would see. But as cataracts progress, you can see on the screen that the field of vision becomes more blurred. It's a little more difficult to make out the yoga instructor's face as those cataracts progress. If we look at or change our hearing loss to a mild hearing loss,
Support yourself and lean away from the left hip and the head goes.
it makes it much harder for an individual to hear what the instructor is saying. I'll also note that the music can be very distracting to someone with hearing loss. It's hard enough to hear, but when you add the extra music, it compounds the ability of someone to hear what an instructor is saying, or a family member, a doctor. Anywhere there might be music playing, it's very difficult and adds to the severity of the interaction that individual can have in the class. So now let's look at macular degeneration.
Everyone hear me okay? Mm-hmm. Okay. Lean forward, push your chest forward so we're not caving down.
Again, here's the normal vision.
Rib cage, pushing it up.
Someone with macular degeneration, as it progresses,
And the head goes.
the field of vision becomes darker
You're using gravity.
and darker and darker, to where eventually they have very little full vision. It's just the peripheral vision, but it is also distorted. We compound that with a hearing loss, a moderate hearing loss. Again, it makes things much more difficult for someone experiencing both a vision and a hearing impairment. And that's with a moderate hearing loss. A lot of people have hearing loss and they don't wear hearing aids. They turn the volume up. They might turn their head to one side to their good ear, so they're getting more of what people are saying. But it's something within our programs we need to consider. What can we do to help address these issues to increase the participation for individuals with vision and hearing loss? Lastly, we want to look at something that's very common, at least in the part of the country I live in, which is San Antonio, Texas, and that's diabetic retinopathy. And this is the normal vision. As diabetic retinopathy progresses, you'll notice the black spots appearing within the field of vision. While the vision is still there, the black spots can obstruct vital information. as far as the visual for the instruction of the yoga instructor. What is she doing? When you couple that with a vision with hearing loss,
Everyone hear me okay? Okay. Lean forward, push
let's do
your chest.
moderate.
So we're not caving down below deep chest. Rib cage, pushing it up. Support yourself and lean away.
Even though the instructor has a microphone, with a moderate hearing loss, it's very difficult, if not impossible, to hear her over the music. These are all things we need to take into account when we're working with individuals with vision and or hearing impairment.
Everyone hear me okay? Lean forward, push your chest.
Okay.
Not caving down below.
So now I want you to think about
Pushing it up. Support
your reactions to these videos. What do you take away from that? What are some things you noticed? What are some things you can look at and address within your own programs? So what are those things? Think about those things that you might have some control over. Maybe it's not playing music in the background. As much as we like music, it can be very distracting for someone with even a mild hearing loss. Maybe it's some other things, and we'll go over those, some options that are possible and things to think about. Before we go out into what we might do to address vision and hearing impairments within our classes, let's look at some of the common reactions to vision and hearing loss. For some, it's traumatic. Later in life, vision and hearing loss, something that happens quickly, can be very traumatic, or just the thought of, now that I'm diagnosed, this is going to happen. And the trauma of that, we need to be aware of that. Irritation and definitely fatigue, because they have to work harder to take in what's happening around them if they can't see it or hear it. Shock and denial. How many people do we know who need hearing aids and won't wear them? Mourning and withdrawal, very common in later in life. Loss of vision and or hearing. Very socially isolated. The loneliness that comes with that. Depression. The reassessment and reaffirmation of where their life is going and what can they do. Coping and mobilization. Finding the resources that can help someone move forward and live independently. The self-acceptance and self-esteem. Sometimes that increased and sometimes it's decreased. Depends on the person's personality and their support system. Do they have people in their corner to help walk with them and build them up? Or do they feel alone? These are all things to consider with the individuals we work with. And this came out of a mental health information from the verywellmind.com. Vision loss, a public health problem from the CDC. I work for the Alamo Area Council of Governments, the BEAR Area Agency on Aging. Our office through the Alamo Council of Governments serves 13 counties through 2 AAAs, or Area Agencies on Aging. I only serve Bexar County, where we have a population of over 2 million people. Of those people, the ones 65 and older are about 250,000, or 12.5%. Of those individuals 65 and over with a hearing impairment, there's almost 8,000 that self-reported a hearing impairment. And for a vision impairment, it's just over 4,000 individuals. And again, these were self-reported through a local organization who did a demographic study. In our county, we do 4 different evidence-based programs. Matter of Balance is our biggest and most popular program. We also do Bingo Size, Chronic Disease and Diabetes Self-Management, and Texercise Select. All of these programs, we have strived to ensure that our participants have modifications and adaptations so that they can participate more fully in these programs. Some of the things we've done, we offer magnifying glasses or handheld magnifiers if needed. Some individuals have their own electronic magnifiers. We are very aware and cognizant of lettering, whether it's on a whiteboard or a flip chart, of using black letters on a white paper or white letters on a black, highlighting in yellow, anything that helps the font and the print stand out. We use large print and offer that to all of our participants who needs it. We want to make sure people understand and know how to use the alt text for screen readers, and we try to adapt our materials to that. The use of 20/20 pens, which is, for those of you who might not know, these are a type of marker that has a tip on it that is more visible for individuals with low vision, and it's easier for them to see than a ballpoint pen. So those are made available. We use audio, podcast, and videos with captioning to make sure that the messages are available auditorially as well as visually. And we try to avoid the paper with that glossy finish to reduce glare. For deaf or hard of hearing, the aids and adaptations can be the subtitles and captions on videos, the use of American Sign Language interpreters, providing seating near our coaches and facilitators so that they can better hear because of the proximity to the coach. We ensure our face can be seen clearly and talk face to face. This was a challenge over COVID, coming out of COVID, with some entities still requiring masks. We had to really provide that distance so that masks could be not worn, or we utilized the clear fronted mask so that mouths could be seen and lips could be read. Repeating and rephrasing information when possible is also important. Asking if you're being heard clearly. If someone's in the back of the room, can they hear you? We want to limit background noise, playing music, those types of things. If you're in a busy office space, try to find a place that is less busy or in the corner somewhere where the noise, the extraneous noise, is limited. And speak clearly and with more volume. We don't have to yell at people, but we do need to speak up. So projecting our voice is very important, and enunciating well so that people can understand what we're saying and we don't mumble when we speak.
So the Matter of Balance program did create a low vision translation. We worked with Deborah Lane, who is the Low Vision Translation Project Director at the Arrowhead Agency on Aging in Duluth, Minnesota, and at the Duluth Lighthouse for the Blind. And the project was funded by the National Eye Institute. And they helped us to create participant workbooks that were available in 12-point and 20-point fonts that can be used with an electronic reader. We also produced coach education material for teaching how to be more inclusive of the low vision population. We did create a Matter of Balance participant workbook and exercises that were available on audio CD for folks who had low enough vision they weren't able to utilize the 12 and 20-point font participant manuals. And we developed enhanced verbal descriptions of the exercises. And I'm going to take you through a comparison of an exercise that's included in our exercise program. And we'll start off with what the original description of that exercise was, and then we'll compare it to the description that's provided in the low vision translation. So I'm going to ask you to follow along with me. This exercise is called the diagonal arm press across the body. And this exercise warms the body and can improve your upper body range of motion, overall balance, and physical endurance. So starting with your left arm, take your left arm and press to the right, away from and across your body. Then alternate your right and left arm. Repeat 5 to 10 times. And in our exercise classes, the leaders of the class, who we call coaches, will demonstrate the exercise as well as read the description. And I am purposefully not demonstrating the exercise for you because I want you to just really listen to the verbal cueing that we're giving. So I'll read it again one more time. Starting with your left arm, press to the right, away from and across your body. Alternate your right and left arm. Repeat 5 to 10 times. So next, I'm going to advance the slide to the description of that same exercise that we developed for our low vision translation. So again, the exercise is called the diagonal arm press across the body. And this exercise warms the body and can improve your upper body range of motion, overall balance, and physical endurance. Start with your left arm. Put your left hand straight out in front of you at shoulder level and move your left hand to the right across your body, keeping it at shoulder level, stretching as if trying to touch something beside you on your right side. Bring your left hand back and into your lap. With your right hand straight out in front of you at shoulder level, move it to the left, stretching across your body, keeping it at shoulder level as if to touch something beside you on the left side. Return your right hand to your lap. Alternate your left and right arm. Repeat 5 to 10 times. That's quite a bit more of instruction, and hopefully you were able to follow along with that. And hopefully if you tried it, I hope you did, that it was easy enough for you to imagine what it is you were supposed to be doing. Because unlike in our original description, this description really provides a lot more orientation for exactly where your arm is supposed to start, in what direction it's supposed to go in, and what to do with your hand when you're done with the movement itself. And so all of the exercises for the Matter Balance program, there's 29 of them, have an enhanced description in the low vision translation, which I think are really fantastic.
In San Antonio, with the Bay Area Agency on Aging, we have had the privilege and honor of working with an amazing coach, Larry Johnson. Larry has been a coach for me in Bexar County since 2017, and he's also become a MOB-V, or a virtual Matter of Balance coach as well. Larry works with the Braille manual, and I'm going to let Larry tell you about how he got involved and a little bit more about our programs.
My name is Larry Johnson. 8 years ago, at a national conference in Denver, Colorado, I attended a workshop on a matter of balance. I was immediately interested in learning more about the program, whether or not it was available in San Antonio, and how I might become involved. When I got back, I contacted the Bay Area. It was available. I immediately signed up to take the volunteer coach trainer certification class. Unfortunately, all the training material was in print, which was a problem for me since I am totally blind. Upon completing the class, I approached the program director, Valerie to ask if it would be possible to get the coach's training material in Braille. Well, she made it happen. And very soon after that, I was conducting mob classes along with a sighted co-coach all over San Antonio using my Braille training manual. I've even co-coached a number of classes for deaf adults, which required the assistance of sign language interpreters. Not everyone uses Braille. In fact, the vast majority of older adults with vision loss do not. They retain sufficient vision to be able to read large print, 16-point type or larger. Some prefer to access material electronically via computer, while others may choose to listen to material recorded on a cartridge or cassette. Older adults with vision loss are nearly twice as likely to experience a fall as a result of not being able to see. So including them in a matter of balance class is extremely important. Figuring out what types of adaptations to make for participants or coaches with visual impairment should be made by consulting the individual. Solutions vary. There is no one-size-fits-all. But showing a willingness to remove barriers so that everyone will be more comfortable and more able to participate more fully in the class and benefit from the mob training is both highly rewarding and very much appreciated. Thank you.
Larry is an amazing man who has really encouraged me and helped me understand and better serve a very underserved population in most of our communities. And it's because of him that we have been able to host 2 classes for the deaf using sign language interpreters and utilizing all of the large print and low vision toolkit materials to enhance and support individuals in our Matter of Balance program. It's been such a valuable partnership with Larry, and he turned 90 in August, and he is still going strong, and he's been wonderful to teach me things. So some of the strategies we've used here locally to include individuals in our classes and to train our coaches, we include the low vision adaptions, the low vision toolkit materials in our coach trainings. It's in their binder. And as a Matter of Balance master trainer, I go over these adaptions during their coach training. So they have the tools they need before they ever get to the first class. During coach training, we model and experience the low vision exercises. And I encourage my coaches to utilize the low vision descriptions in their classes so that they ensure they're doing the exercise properly, that they are including everyone, because some people do not disclose at first that they have a vision or a hearing problem or issue. And so this allows them to include people without singling anybody out. And it gives me the peace of mind that the fidelity of our programs is being secured by consistent delivery of our programs. Our coaches are receiving the original description of the exercises as well as the low vision. And so there's no excuse. When I do my fidelity checks and they're doing exercises wrong, I stop the class and tell them, why don't we flip over to the low vision descriptions so that they understand and are able to do that correctly. Before all of my classes, I encourage my coaches to find out as soon as possible and tell their class, do you need low vision or large print material or audio? And that is made available as soon as possible to that individual. And the audio versions, they get to keep those. They can take them home. So that helps that outcome percentage of 99% continuing to do exercises. They've got the tools, and it's important that they have those in a format that they can utilize outside of the class. Recruiting and adapting our programs. I have worked with community partners who already serve individuals with vision and/or hearing impairments in order to maximize our resources and provide those adaptations. I didn't know everything. I knew very little when Larry first came to me, but he helped connect me with entities that are in our community. And so we offer those adaptions, whether it's large print, audio. We know where our community partners are that have the knowledge and the expertise with assisted listening devices, or our sign language interpreters that are available, and working with them. We want to be teachable and willing to ask for assistance from those that know. And it's not about me at the end of the day, it's about serving the individuals who sit in my classes and finding those individuals. Our classes that we've done for the deaf and hard of hearing, I work with deaf interpreter services who that is their population, and they were able to get out the word through a newsletter and a email blast that we were having this class, Matter of Balance, and there would be interpreters there. And we had no trouble filling 2 classes. And so it's finding who has the pool of people you might be not serving completely. Your Lighthouse for the Blind or other entities might also be an option to look at. Your community colleges and universities, a lot of them have offices of disabilities resources. They're called different things. Your local education service center for your K-12s also will have some resources you may be able to tap into for serving older adult populations. So being creative and finding those resources, sometimes it's all about asking the question, and somebody can help provide an answer or a direction. So think about that. So again, just in closing, we want to look at asking for assistance if you need it. Who are those people who might have that information? Maintain a consistent room setup. This is important for those who have vision loss. And the room is changed every week. We add hazards, and we don't want to do that. It's a falls prevention class, and we definitely don't want to increase the falls hazard by rearranging the furniture. So it's very important that we try to be consistent on that. We want to have our participants verbally identify themselves each session and encourage them maybe to sit in the same place. That also can assist individuals with low vision to get to know their class participants and be included in that conversation. You want to provide verbal as well as written formats of information if at all possible, and large print is always best. Be specific and clear on directions. Think about, well, if you need to take a call, just go out that door over there. Well, over there doesn't mean anything if you can't see the door. And so we want to make sure that we give clear and direct directions. Try to be positive and patient. Listen to what people are saying and what they need, and then ask them if they have suggestions on how to go about fulfilling those needs so that you have better knowledge for the next class. We do want to encourage self-sufficiency whenever possible. And so it may be that we need to help individuals who cannot see the paperwork fill it out. But maybe it's a simple resource of a magnifier they can hold while they fill out registration paperwork or surveys. Have those things available, or at least know where you can find them. And if needed, you want to have additional people available to assist, either with getting individuals from the door to the classroom. Larry is totally blind. When he co-facilitates classes, someone meets him at his paratransit drop and walks with him to where the class is, and then takes him back so he can get his transportation. It's easy to figure out. You just have to ask someone to help, but they usually will. A lot of times you get those helpers from within your class also. So these are some things to think about when you move forward with trying to implement more inclusiveness within your evidence-based programs.
All right, so I think I know we're at the end of our presentation, and what we would really like to do is to give you some time to formulate a plan, to do some brainstorming together on how you will increase inclusion for leaders and participants into your evidence-based falls prevention programming. And we'd love it if you would share something in the chat that something that would be simple for you to do right away, something that you could take away from this presentation that would really help to make one good step forward in increasing your accessibility to your programming for either participants or for your leaders of your programming, or both. And then also be thinking about something that would be a little bit more of a reach, but it would be possible. And perhaps that's something like getting more familiar with the subject matter experts in your area. So be thinking about those things, and we'd love to have you share them in the chat, or if we're able to unmute and share together.
We thank you for listening to Making a Difference, Social Isolation, Vision, Hearing, and Falls Prevention. We hope you found the information helpful, and we'll find ways to not only promote falls prevention, but also gained ideas on how to make programs more accessible and inclusive.